County Commissioner, members from the national and county government who are present here, the members of the Fourth Estate, good afternoon. On 20th April 2020, the county registered its first case of COVID-19. The following day, on 1st May 2020, one of the traveling companions of the first case has tested positive for coronavirus disease, putting the county number of confirmed cases at 2. That was as 1st of May. Both cases were persons who traveled back from Mogadishu, Somalia, on a livestock trade. As you are aware, Somalia has overtaken our country in the last few days over the number of cases with COVID-19. The long porous border with Somalia is now the new front of infections in our country. Since our people are mostly livestock herders and traders who crisscross the border more often, thereby necessitating heightened surveillance on the border towns, with emphasis on Dif and Dajibula towns. Our efforts bore fruits, and we intercepted more individuals sneaking back into our country and the contacts of the earlier ones. We currently have 31 of them quarantined in the following centers. 1, KMTC Wajir, they are 12. Dif, they are 10. Habaswein, 8. Dajibula, 1. In the last 24 hours, we had tested 9 samples in our regional lab, but unfortunately, 5 of them tested positive, bringing the total number of confirmed cases with COVID-19 to 7. 2 of the 5 cases that tested positive in the last 24 hours were with the 4 earlier intercepted at Dif, but managed to escape the police roadblock and made their way to Wajir town unnoticed. The other 3 were on their way back from Mogadishu, Somalia, on a similar livestock trade and were intercepted at Riba of Wajir East Sub-County. All the 7 positive cases are in Wajir County Referral Hospital Isolation Ward and are in stable condition. With these confirmed cases in Dif, the health department sent personnel and supplies that oversaw the following interventions. 1, they set up a quarantine and isolation centers in Dif town to limit the spread of the disease. 2. Fumigation of the Diff police station, where suspected cases from Mogadishu stayed overnight, and the local taxi that ferried them to Wajir were all fumigated. 3. The health officials formed a multi-sectoral emergency response team of 13 persons drawn from health department, security agencies, religious leaders, town administrators, and elders. 4. Health workers sensitization. Over 15 staff sensitized on COVID-19 prevention and management strategies, including protecting oneself, community engagement, and health education. Stakeholders engagement and mobilization. Contact tracing, enforcement of government directives, that is movement and restriction of people in and out of Diff town, prevention measures such as having hand washing facilities, face masks, and so on. Strengthening cross-border coordination and information sharing between Diff of Kenya and Diff of Somalia. The lockdown in Diff is working as we talk, and I therefore thank the multidisciplinary security agencies such as the KDF, police, border patrol units for their cooperation in enforcing the lockdown. Let us not be tired at this critical moment, but instead solve as community to double our efforts now that as a county the disease appears to be pushing us harder. Finally, I appreciate Glacier Water Company for their donation of 30 cartons of water, dates for iftar at the quarantine and isolation facilities, and radio spots of Wajir County, Wajir Community Radio and local FMs. Similarly, we acknowledge the support made to the health department by Islamic Relief, Save the Children, and WASDA. Let us all emulate these organizations and contribute towards the control of this pandemic.
I think whatever has been read, we have been adopting multi-agency approach in ensuring that all these interceptions, the ones in Diff, the ones in Riba, even here in town, this was the work of the national government administrative officers and the security agencies, and of course the technical team from the Ministry of Health of the county government of Wajir. So I think for now it's about tracing contacts, isn't it? You members of the fourth estate and wananchi in general in Wajir, it is not business as usual. We are now, Mandera got a lockdown when they were at 8, isn't it? Now we are at 7. If in the next couple of days the situation continues as it is now, then there is a likelihood of us being put under the same lockdown, because now it's like the situation is increasing day by day. But what we are appealing to wananchi in Wajir County, especially the livestock traders and na walimu wa dini. I know people were caught up when they were across, but now that they are coming back for whatever reasons, this is the high time that they should surrender to the nearest health facility so that their health condition can be checked, kuliko kuambukiza watu. Kama sasa mali huyu hao jamaa wawili walishika orai busy chewing miraa na huyo mama ambaye alikuwa anauza miraa. In that particular family there are 25 other people. So tell me, kama alikuwa na chew miraa hapo nje, sasa watu 25 wengine are they safe? Are they safe? Sasa ni wakati na ni mujibu wa kila mkaji wa Wajir tuhakikishe kwamba tuko rada, tuko macho na kuripot hao walimu wa dini ambao walikuwa double na Somalia in general na livestock traders. Jini livestock traders ama ni Al-Shabaab ndio wanatoroka, I don't know, but you should be able to tell us. But our security agencies will be vigilant along the borderline and ensure that interceptions and roadblocks are placed in strategic areas. But what is more critical ni wananchi kuvolunteer information. Hiyo tu, hata kwa hii town and in all the 8 sub-counties within the county. Ukikubali mtu in the name of sijui ati mfanya biashara wa ng'ombe alikuwa ameenda Somalia na ya ngamia na anakuja kukaa kwako, hiyo ni kama tu wewe umesign some kind of death warrant. Expose that person, expose that visitor, let him be picked by the health team, let him be tested, let him be quarantined so that he does not mix with the rest of the innocent people. Kwa sababu sasa hii cases kama sasa hii ya leo wale watatu tuliwashika riba, wale wengine, na kati ya watatu ni watu ambayo wanatoka Wajir West. Wajir West walikuwa wameenda biashara ya livestock huko. Kwa hivyo sasa ni mujibu kila mkaji wa Wajir, tafadhali tushirikiane pamoja kuhakikisha kwamba tuna share information. Kuna ile hotline ya county, si tuko na hotline, report any suspicious case so that unajua now hiyo community transmission is what we are trying to address. Mtu mmoja anaweza kuhakikisha kwamba ameambukiza as many people as possible. So the more we intercept him or her before transmitting to other innocent people, the better.